Have you been waking up at 3 a.m. feeling more anxious than usual or noticing changes in your body that don't make sense? You might assume it's stress. Many doctors do too, but these can actually be some of the earliest signs of perimenopause. I'm Dr. Nirvana, a naturopathic doctor, and today I'm sharing 3 hidden signs of perimenopause that women often miss because nobody tells them what to look for. All right, sign number 1 is migraines. Most women know that hormones can trigger headaches, but what they don't realize is that the kind of migraines that show up in perimenopause are often different from anything they've experienced before. Estrogen fluctuations, specifically the erratic drops that happen in perimenopause use, directly affect your serotonin levels and the blood vessels in your brain. So what you end up with is a migraine pattern that doesn't match your old triggers, and it doesn't respond to your usual remedies as well, and seems to come out of nowhere. If your migraines have gotten worse, more frequent, or just different in the last 1 to 3 years, and no one has asked you where you are in your menstrual cycle or your hormone transition, that's a problem. This is a root cause conversation, not just a pain management conversation. Now, sign number 2 is itchy ears. I know, it sounds strange, but I can't tell you how many women sit across from me and say, this is going to sound crazy, but my ears have been itching like crazy and I can't figure out why. It's not crazy at all. Estrogen plays a significant role in keeping mucous membranes moist throughout your entire body, including the ear canals. As estrogen drops in perimenopause, the ear canal can become dry, irritated, and intensely itchy. It has nothing to do with an infection or allergies. It's just a hormonal symptom. By the way, if you want to go deeper on any of these symptoms we're covering today, check the description and the pinned comment below. And now, sign number 3. It's ringing in the ears, also called tinnitus. This one tends to shock women most because tinnitus is almost never discussed in the context of perimenopause, but the connection is real. Estrogen receptors exist in the auditory system, meaning your ears are literally hormonally responsive tissue. As estrogen levels fluctuate and decline, some women can develop a persistent ringing or buzzing or whooshing sound that can be constant or intermittent. If you've been to an ENT doc, had your hearing tested, and been told everything looks normal, hormones may be the missing piece of that puzzle. So, to bring this together, migraines that shift in pattern, ears that won't stop itching, and ringing in your ears that came out of nowhere, these aren't random. These aren't in your head. These are legitimate perimenopausal symptoms that deserve a real clinical conversation. If you want to understand more about what's actually happening with your hormones during this transition, check out the next video about perimenopause.